You with us. Now, turning to our final keynote speaker, it's my pleasure to introduce Harry Totonis, President and CEO of Surescripts. As you will hear shortly, Harry comes to healthcare with a background in financial services. His expertise in networks, information sharing, and data security is critical as healthcare undergoes its profound transformation. Surescripts is an exciting company to watch. Its expansion from e-prescribing to laboratory tests, immunizations, and mobile app challenges is a testament to Harry's leadership and vision. We are pleased that Surescripts has joined us as a platinum sponsor and to have Harry here to share his thoughts about today's mobile health, technology, connectivity, and lowering costs. Please welcome Harry Totonis. Thanks so much. Really do appreciate it.
It's always good to start with that. Thank you, Steve. It's a pleasure to be here. And good morning, everyone. Before I launch into my comments, I wanted to take a few minutes and share some personal items that I believe are relevant to this occasion. First, my teenage daughter is in the audience. For all of you out there who are living right now through the teenage years of a child, or if you can remember those years, you understand the pressure that I'm feeling. If she drops off the grid, it's my fault. The other relevant personal item that you need to know, as Steve mentioned, that most of my career has been spent outside of healthcare. In fact, all but the last 5 years. I started my career in management consulting, where I had the opportunity to work across several industries that went structural transformation. Later in my career, I was in financial services, another industry that has extensively leveraged technology and connectivity to drive change. This experience is one of two main reasons why I'm here this morning. As the healthcare industry restructures, there's a lot we can learn from the experience of financial services and other industries that go through major transformations. The other reason why I'm up here this morning is because I lead a company, Surescripts, that is driving transformation in healthcare. So what typically happens when industries restructure? Well, many things, but two key outcomes are almost certain. One is greater efficiency through consolidation and by taking significant costs out of the system. The other, and I'm going to use a consulting jargon, is customer centrality. When industries restructure, they tend to rediscover the customers or the end user, and they begin by saying things like, we need to put the customer or the consumer in the middle, or we need to focus on what our customers want. And by doing exactly that, there is further cost savings by eliminating low-value activities. Both of these two key outcomes are exactly what our healthcare system needs. Almost everyone agrees that healthcare is too expensive. There's also agreement that it is necessary to put the patient in the middle. The reality is that we've heard time and again from well-regarded bipartisan groups that we simply don't have enough money to pay for the healthcare we want to provide. The solution that everyone is talking about is that we need to bend the cost curve. The good news is when industries restructure, they bend the cost curve. And consistent with the theme of this session, patient engagement and involvement are essential if we are going to achieve these goals. Financial services, travel, telecom, retailing, music, and Apple are examples of industries that have gone significant restructuring. Many traditional participants disappeared. New entrants are now key players. There has been extensive consolidation. We have new products and services. Consumers are more empowered, and the industry cost curve is very different. And one more very important thing. Technology and connectivity have been key drivers in enabling industry change. So for this morning, I'm going to focus my remarks on connectivity and technology. So where are we in healthcare? While there is agreement that we need to bend the cost curve and put the patient in the middle, there's a great deal of frustration about the pace of progress. From where I stand, I see a lot more progress, and I'm optimistic. Yes, the challenge is greater in healthcare than in most industries, but for obvious reasons. But the restructuring is underway, and we are making progress. Many things are happening. Examples do exist in healthcare where we are bending the cost curve, and I'm going to describe one of them in a few minutes. We're starting to put the end user in the middle, and in healthcare, I believe we have two end users, the physician and the patient. Technology and connectivity is driving the change. The potential is unlimited, and the pace will accelerate. My perspective is that we need to accelerate in connecting healthcare, accelerate what we've started. We need to connect all the elements of the healthcare system and allow them to share information. This information sharing must not only involve large organizations. It is important that we connect small health systems, physicians, and patients. By connecting and sharing data, a number of important things happen. You eliminate paper, you eliminate faxes, you improve operations and achieve care delivery savings. It means that you don't have to duplicate that lab order that was already issued 2 weeks ago. The doctor's office doesn't have to waste hours trying to collect the patient's records. Patients get alerts to take their medications so they don't make expensive return trips to the hospital. And that brings me to the fourth point, that by connecting and sharing with the patient, you put the patient in the workflow. They are able to start taking greater responsibility for their own health. And finally, we need to look down the road. The vision starts with connecting and sharing, but it quickly leads to incredible results that improve health outcomes and results in greater cost savings. So for example, about a month ago, I was on a panel with prominent health system executives. They spoke of a major national known hospital and the EHR system that they're installing. They estimate the cost to be nearly $1 billion. That's not the cost of the software. That's the cost of retraining physicians and changing the workflow to deliver care in a new way, powered by connectivity. That is meaningful restructuring. It leads to huge opportunities. It has worked in other industries, and it will work in healthcare. So I said I came from financial services, so let me use financial services and credit and debit cards as an example. I remember on inscriptions on the walls of MasterCard. It talked about the war on cash. The vision was to substitute plastic for paper. Why? The reasons are clear. Plastic is less expensive to handle than piles of cash and checks. Just ask any merchant. Plastic is much safer than money. If a card is stolen, consumers are not responsible for the purchases they did not make. If cash is stolen, well, you know what happens. And plastic is much more convenient. On my last trip to Europe, I landed in Germany with $5 in my pocket. I had to spend a week in Europe. But with cards, mobile apps, and ATMs, I was just fine. Substituting plastic for cash and realizing great benefits was enabled by connectivity. Connectivity among thousands of financial services institutions around the world and millions of merchants, coupled with automated fund verification, currency conversions, clearing, fraud and settlement processes, have enabled transformation for the industry to drive great benefits and convenience for consumer. You may be surprised about this, but today people around the world use nearly 8 billion cards at over 1 billion locations to complete a transaction in a nanosecond, costing fractions of a penny. But consumers don't care about technologies that interest all of us in the room. They're interested in completing their purchase in an instant and not getting declined. And that's what financial industry has accomplished. We have greater convenience, less cost, greater safety, and improved ability for consumers to take greater accountability for their financial picture. We may find the technology behind the scenes interesting, but it's the end results that matter for millions of users. And that's what we need to keep in mind as we transform healthcare. Now, I mentioned my trip to Europe. Let me compare that experience with what I and others experience every day in our healthcare system. Last week, I set up an appointment for one of my children to see a specialist. Don't worry, I have my child's permission to talk about this. There are no HIPAA violations this morning. The specialist called me up and asked for the history of the case, past doctor's notes, medication history, current therapy, and so on. These are all very reasonable requests. But here's the problem. First, I don't have access to any of that information. And unlike my financial services accounts, I can't go online and download an app to access my accounts and balances. I had to compile them. And it took numerous phone calls and a great difficulty finding the right people to fax the information to me. Not email, fax. After a few days, I compiled this information, scanned it, and sent it over to the specialist who would be treating my child. Bottom line, it took a lot of time, a lot of effort, and was a less secure way of moving clinical information. Ubiquitous connectivity and sharing is the first problem that we need to be solved in healthcare. The federal government has done a great job getting the ball rolling in this direction. The high-tech legislation passed in 2008 has invested roughly $20 billion to place technology in the hands of providers. The Meaningful Use program has created a three-step roadmap to making progress. It is incentivizing physicians to buy the systems needed to capture and store information. It is encouraging physicians to share the information with each other. It is providing incentives to use and analyze the shared data to improve outcomes and bend the cost curve. But progress has actually started before the high-tech legislation. Over a dozen years ago, the nation's pharmacies and pharmacy benefit management companies had a vision of how prescriptions of medications could be done better without the old-fashioned pen and paper approach. At that time, nearly all doctors were scribbling out prescriptions and handing them to the patients or faxing them to the pharmacy. We know the results. Too many cases where pharmacists could not read the doctor's handwriting. Too many cases where patients got the wrong drugs. Too many cases where one doctor did not know what another physician had already prescribed, with adverse drug reactions as a result. The pharmacy and the PBM industries recognizing that by connecting the participants through a neutral entity was key to change. So they launched Surescripts. Today, Surescripts is the nation's largest clinical information network that allows prescribers, pharmacies, and payers to share prescription information securely and quickly. Enabling secure access to this information yields three objectives, and we're very proud of those three objectives. One, we improve health outcomes. Two, we enhance care and collaboration. And three, we lower cost. Surescripts today connects providers through their EHR systems to pharmacies and PBMs to make electronic prescribing happen. Pen and paper are replaced with digital data. Payers provide access to a patient's medication history and formulary information so that the provider can write the best prescription possible. The prescription is sent electronically to the patient's choice of pharmacy before he or she leaves the doctor's office. When the patient walks into the pharmacy, the prescription is ready and waiting for them. And now, the pharmacist has time to consult with the patient rather than just filling bottles with pills. We've created ease and convenience, but getting there was not easy. We faced many obstacles. We had to connect many organizations. Providers were skeptical. Participants needed to buy and develop the necessary technology. New workflows needed to be implemented. Privacy and security issues had to be addressed. Patient confidence needed to be earned. The business case had to be made. A great deal of collaboration had to take place. But Surescripts worked on these issues and transformed healthcare. In less than 10 years, the amount of clinical information flowing through the network from pharmacies, PBMs, and EHRs has exploded. Consider this. Just today, while we're getting together at this summit, 340,000 prescribers will send their prescriptions across the network. In 2012, Surescripts will process over 4 billion health messages. That's an average of 12 million messages per day. 96% of all the pharmacies are connected. Over 60% of office-based prescribers e-prescribe. And 50% of all prescriptions are moving electronically. The results have been striking. Fewer medication-based errors, fewer adverse drug reactions, and the cost of e-prescribing is just 10% of doing a prescription by paper. That's 90% of the cost eliminated. But more than that, we have changed patient behaviors. The World Health Organization has estimated that 50% of the patients do not adhere to the medication treatments. That means expensive trips back to the hospital or to the emergency room. But when that prescription is transmitted electronically to the pharmacist, it is more likely to be picked up and used. If nothing else, the pharmacist will give you a call and say, your prescription is ready, please come and pick it up. So e-prescribing alone leads to medication therapy compliance, better health outcomes, greater patient safety, streamlining workflow at the physician's office, and lower cost. In fact, a study has found that over 10 years, e-prescribing will save the healthcare system up to $240 billion because of these improvements. That's huge. These benefits are real, they're substantial, and what makes me excited is that we're just beginning. If this level of connectivity can change prescribing of medication, it can work in other and all clinical transactions. To reiterate, what I have seen occurred in cards and financial services is very similar to the e-prescribing experience. Replacing electronic prescriptions with paper, the war on cash. Which brings me to the next phase of health system transformation. We are now leveraging what we've learned in e-prescribing to enable connectivity and usability beyond prescriptions. Our clinical interoperability program that we announced 18 months ago aims at moving all types of clinical information. Clinical messaging through Surescripts includes immunization notifications, structured and unstructured physician notes, referrals, discharge summaries, and continuity of care records. Making clinical information available when and where it's needed will further facilitate access to vital information, reduce errors, increase efficiency, and yes, bend the cost curve. The first step of connectivity and sharing leads to a lot of new opportunities. So, for example, we found out that we are able to connect providers with the Rhode Island Department of Health so the state could monitor flu outbreaks and take action to improve the health and safety of their citizens. I'm very proud that Surescripts is engaged in the Million Hearts Challenge. We are supporting the technology and the development and the connectivity necessary to bring pharmacy and consumers together for health screening through mobile apps. These apps will help consumers conduct their own health risk assessments and find local pharmacies that are offering the needed health screenings. That's where we're involved. And on that point, I would like to invite you to join me and my colleagues, ONC's Farshad Mastashari, and Million Hearts Executive Director, Dr. Janet Wright, as well as Josh Adler from Archimedes at 11:45 today at the Digital Media Pavilion for a big announcement. We will identify the 5 innovators who have been selected as a finalist in the Million Hearts App Developer Challenge. I hope to see you all there. And very importantly, it isn't only what Surescripts is doing that makes this change happen. This morning you heard Mr. Barolini share his ideas. Aetna is using technology and connectivity to engage consumers in their own health care and to encourage better health behavior. And companies like Aetna are using information to determine the best, most effective treatment for patients. So we're keeping people well instead of continuing to treat symptoms. What Surescripts is doing, what Aetna is doing, and what many other organizations are pursuing is just the beginning of what is possible. As our healthcare system faces new threats, ranging from chronic disease growth to hospital-based infections, imagine the power of clinical information networks to share information, improve practices, and expand our body of knowledge. We can elevate patient care and curb costs. Earlier, I mentioned the skepticism that often accompanies change. To me, this is not a time for doubt, but rather a time for optimism, excitement, and a belief in unlimited possibilities. I'm a big fan of the show Nova on PBS. Recently, Nova featured the work of Carnegie Mellon professor Adrian Troy. He harnessed the collective brain power of people to solve complex problems. What he did is absolutely fascinating. He brought together 30,000 gamers, the people who spend hours with World of Warcraft and other simulation games. Some of these players were as young as 9 years old. He harnessed connectivity and technology and put these individuals to work on challenges involving DNA and RNA design. Working in collaboration, using technology and connectivity to share ideas with each other, the collective brain power of 30,000 people reached solutions that even most powerful computers could not. What does this tell us about healthcare? I believe we need to break down the silos. We need to connect all of healthcare, including the patient. I have seen the benefits in financial services and other industries when you drive connectivity. I know we could improve outcomes and reduce costs. I believe we are on a precipice of dramatic change in healthcare. Today, we're making good progress, but that will pale in comparison to what is yet to come. Thank you very much.
Ladies and gentlemen, please welcome Mr. Christopher Hill, Senior Vice President of AT&T.
Good morning, everyone. We're all here this morning because we're excited and optimistic about the future that mobile technology can bring to healthcare. And one of the things that I get to do on a day-to-day basis is transform business and industries through the applications of mobile technologies. And one example that I want to give, and I'm going to digress just a bit from healthcare to show you how we've done this in other industries, and I promise to bring it back here in just a minute. And that is Amtrak. Probably everyone here has ridden Amtrak at some point in time, and you're very familiar with the process by which they used to take your ticket. The hole punch has been used for over a century, and using paper-based processes to collect tickets and understand what their manifest records are and track that through a very labor-intensive and manual way. But hopefully you realized in the last year or so, if you've been riding recently, as I did this morning at 5 a.m. to come down, that you are seeing folks walking now. Conductors are walking through the train aisles with a smartphone, and they are scanning your ticket now, and that is instantaneously updating manifest records, as well as giving you the ability to purchase tickets on the train now, increasing revenue, decreasing costs for Amtrak. And AT&T's did this through an end-to-end e-ticketing solution that we worked with Amtrak on for a number of months. And we've deployed that, as I stated, with a smartphone application that is hosted and managed in AT&T's cloud and integrated back into Amtrak's back-end systems to provide that updating. And this is a great example in terms of renovating a process that has been in place for nearly a century. And so you take a look at Amtrak, and you look at this, and so why is it important to healthcare? Because it's a good example of a meaningful use application and the opportunity that mobile brings in transforming an industry. And so as we look at this and as we change what we're doing in the healthcare industry, I think it's important as we take a look at what's going on in mobile adoption overall and how does that portray to the healthcare industry. And so first and foremost, you can see mobile adoption, no surprise to anyone, is increasing at a rapid rate. You look at industries such as mobile banking, tripling over the next 5 years, to mobile commerce, and many of you probably experienced that through Black Friday and other events here on your mobile devices, tablets and otherwise, to what the smartphone penetration is doing here. And you look at the adoption rate, was only 25% of subscribers just 2 years ago had a smartphone. That's now well in excess of 50% in the overall industry. But then you look at healthcare and what is going on there and the adoption rate that we're seeing. Only 11% of mobile users have downloaded a healthcare application, and even far fewer than that are actually using that application. So why is that? It is not because there is a lack of supply. If you've been to any one of the app stores, there are tens of thousands of applications that are out there today. And it's not due to demand. If you look at many surveys, users come back and they're interested and want to be able to connect to their providers, get access to their healthcare information, and how do they better treat a condition that they may have. And so what is the issue? We firmly believe the issue is that these are disconnected applications, that you have many developers that go directly from a mobile application direct to consumers, and it's not linked into the overall healthcare ecosystem. And so we've been looking at that, and one of the examples that we have, and we've seen significant success to date, is in our AT&T Diabetes Manager. And you look at what we've done here, this is a holistic solution that is not just an application. Yes, there is a smartphone application that allows the type 2 diabetic to enter their blood sugar information and get real-time coaching back from the application on actions that they should take and how do they treat the condition and live a more healthy lifestyle. But we've connected that back into nurse call centers as well as case managers to allow real-time data information to come back in and start to establish trending information. And so the opportunity to be able to take action on that in a much more proactive manner than has ever been done before. And we've seen some significant results in our most recent pilot with a Medicaid population of over 600. We've seen a 55% drop in the number of hospitalizations in just a short period of time that we've been running the pilot. And more importantly, we've also seen significant results relative to the adoption rate and the feedback we're receiving. So 93% of the users that have tried the application have come back and would recommend it to other users. And this is not the only pilot we have going on. AT&T is doing this internally. We insure over 1 million lives and active employees as well as retirees. So we have a great population cross-section of the U.S. to do this, and we are piloting this internally as well. And so we're seeing significant results there, and the reason we're seeing that is, as I stated, this is a connected solution. It's linking together both the patient as well as the provider, the insurer, and the ability to link in as well with pharmacies. We look beyond that, and what are the other areas? We look at how we're doing innovation across the healthcare industry, and you see examples in what we're doing in healthcare information exchange, to telehealth, to an aging population where we can deploy sensors as well as gait technologies to understand predictive analytics on likelihood to fall, to our cloud-based solutions, which be able to do storage across multiple proprietary systems in the cloud and give access to that across many different constituents, to remote patient monitoring. So a wealth of technology being applied in an innovative manner across the healthcare continuum. So one of the things that we do across AT&T in looking at what we're partnering with is the legacy of innovation that AT&T's had. And you look at over 136 years of innovation, 8 Nobel Prizes, and we're generating on average of 2 patents per day. And we're doing this across our AT&T labs, as well as what you see there is our AT&T Foundry. Our AT&T Foundry is our innovation center and the ability for us to take a look and bring together developers, third-party solutions to allow us to try out and test and rapidly prototype different solutions. And this is the area where we initially did work with our diabetes manager to do human factor studies. And it also has led to our mHealth developer platform. And this is a platform that allows the interconnections of hospitals, developers, patient information relative to mobile use, mobile data analytics, and tie that also back into insurers as well as providers. And it allows developers to come in and get access to that anonymized information in a secure manner to develop better applications that are connected from the get-go. And we think this will be a very important step in allowing the design and the deployment of applications that are able to drive up that 11% number that I showed earlier. And that number over the last 3 years has not changed. So we're not seeing, it's a very static number. And so something has to be done. And we think the ability to connect these various applications, devices, and the ecosystem is going to yield to a much better outcome relative to adoption rates and then ultimately meaningful use to drive down both cost as well as improve care. One of the other areas that we're doing in our AT&T labs is a project we have underway for asthma patients and the ability for them to better manage their condition. Our research labs have developed a sensor that is able to identify various chemical levels and report those back in the air and report those back on a dashboard, either on a tablet, a PC, or a smartphone, and allows the asthma patient to better manage their condition in a proactive manner so that they know the environment that they're in and some of the things that they may want to proactively treat their condition. It doesn't matter whether the innovation is coming from AT&T or third-party developers. The key is that we move mHealth forward and to develop technology that connects patients and healthcare providers. And so, in conclusion, we may not be in far as long as we wish to be with respect to mHealth, but we're making significant strides. And hopefully a few of the applications that you've seen have shown that we are moving the ball forward. And we can't afford to stay in this place any longer. And it's going to take the entire community here to tackle a $2.7 trillion problem. The innovation is going to enable change and allow us to utilize the ability to collaborate with the healthcare community to deliver innovation in the form of new technologies and solutions, and the ability to combine mobile applications, devices, and the medical knowledge through the professionals that are out there today to be able to create a meaningful mHealth innovation and revolution. It's up to all of us in the room today to make that happen, and I believe that we will. So thank you, and I hope you enjoy the summit today.